If your eyes take longer than 10 minutes to focus after you wake up, that's not aging. That's proof your eyes didn't repair properly overnight. And the worst part? What you're doing every morning might be making it worse. I'm Dr. Malik Jackson, 19 years in clinical ophthalmology, right here in Nashville. And I want to be straight with you from the start. The way most people over 60 are managing their vision is completely backwards. Not because they're careless, because nobody ever explained what's actually happening inside their eyes while they sleep. Here's the reality. Your retina runs a repair cycle every single night. Think of it like a pit crew at a NASCAR race, fast, precise, working under pressure, but only as good as the parts they have on hand. Most nights, that crew shows up and the supply cabinet is empty. So instead of repairing, they're just managing the damage. Tonight, I'm going to walk you through 7 fruits, not supplements, not prescriptions, actual fruits at any grocery store that give that repair crew exactly what they need. Compounds that support cell regeneration and improve blood flow to the back of your eye. And they target a process called glycation. Think of it like slow rust forming inside your lens, invisible, painless, and most people don't catch it until the damage is already done. The number 1 fruit on this list goes directly after that, and your doctor's almost certainly never brought it up. Stay for that one. It changes things. Before we start, quick question, and I actually want you to answer this in the comments. When your eyes are blurry in the morning, do you reach for eye drops, splash cold water on your face, or just wait it out with coffee? Your answer tells me which part of this list matters most for you. Everything here is educational. Keep working with your own eye doctor. These aren't replacements for professional care. They're tools your doctor probably hasn't handed you yet. Now, let me tell you about a patient who walked into my office carrying a Ziploc bag full of eye drops that weren't working. His name was Gerald, 67 years old, retired engineer out of Phoenix, Arizona. He set that bag right on my desk, 4 different brands, 2 of them prescription strength, and looked at me like he was out of options. I wake up and I can't see, he said, not blurry, blind, like someone smeared grease on my eyes. Takes an hour to clear. Gerald had been managing symptoms for 3 years. Eye drops, stronger glasses, different lighting in his house. Nobody had ever asked him what he was eating before bed. Nobody had talked to him about what his retina actually needs at night. That conversation changed his life. And it's the same conversation I want to have with you right now. Here's what most people don't know. Your retina is one of the most metabolically active tissues in your entire body. It consumes more oxygen per unit of tissue than your heart muscle. And at night, specifically between 1 a.m. and 4 a.m., it enters its primary repair window. During that window, damaged photoreceptor cells try to regenerate. Inflammation tries to resolve. Oxidative stress tries to clear. But all of that requires specific raw materials, and most people's diets are completely missing them. The National Eye Institute confirmed this. After 60, oxidative stress in retinal tissue increases by up to 40%. And that stress peaks at night, exactly when your eyes are supposed to be healing. Gerald wasn't just unlucky, he was underfueled. So let's fix that. Starting with number 7. Number 7, Golden Kiwi. Most people hear kiwi and think, yeah, I've heard that before. But stay with me, because the way almost everyone eats kiwi is costing them more than half the benefit. Golden kiwi, not green, golden contains 2 of the most studied nutrients in eye research, lutein and zeaxanthin. Think of these like the tinted lenses your retina makes for itself. They sit inside the layers of your retina, absorbing harmful blue light and protecting photoreceptors during sleep. A study published in the Journal of Nutrition and Healthy Aging followed adults over 60 who ate 2 golden kiwis daily for 8 weeks. The results showed measurable improvements in visual sharpness and a significant reduction in morning dryness and eye redness. 2 pieces of fruit, 8 weeks. Measurable results. Here's the part most people get wrong. Don't peel all the way to the edge. That thin layer of pale flesh just beneath the skin, that's where caffeic acid concentrates. It's one of the most potent antioxidants in the entire fruit. When you peel aggressively, you're throwing away the best part. Scoop with a spoon and leave that inner edge intact. Eat 2 golden kiwis about 60 minutes before bed. Golden, not green. They carry more lutein, produce less acid, and sit easier on your stomach late at night. Simple change. Real difference. Kiwi handles the filter, those internal tinted lenses protecting your photoreceptors. But if the pipes delivering blood to that filter are sluggish, the filter can't do its job. That's watermelon's job. And it starts with a patient named Sandra. Number 6, watermelon. Sandra is 71. She lives outside Tampa, Florida. Every summer, she eats watermelon almost every day just because she loves it. One July, her eye doctor told her something that stopped her cold. "Whatever you're doing," he said, "your retinal health looks better than patients 10 years younger than you." Sandra had no idea why. I do. Watermelon is over 90% water, so hydration is the obvious benefit. But the research points to something deeper. Watermelon is one of the richest dietary sources of lycopene, a carotenoid antioxidant that researchers keep coming back to. A 2019 review published in Nutrients analyzed lycopene's role in retinal cell protection across 14 separate studies. The consistent finding, meaningful association with reduced oxidative damage and meaningfully lower cataract risk in adults over 60, 14 studies pointing in the same direction. That's not a coincidence. Beyond that, certain compounds in watermelon support nitric oxide production, which improves blood flow to the tiny capillaries supplying your retina during sleep. That's why Sandra's summers were doing more than keeping her cool. One warning: skip the salt. I know it tastes better. But added sodium increases intraocular pressure, and elevated eye pressure is one of the most significant risk factors for permanent vision loss. Don't salt your way to a problem you can't undo. 1 to 2 cups of chilled seedless watermelon 30 minutes before bed. And don't throw away the rind. That white section near the skin is packed with citrulline, an amino acid that supports healthy blood vessel function. Blend it into a smoothie if you're not going to eat it straight. Hold on, before I keep going, I need to say something directly. If you're watching this because your vision has been getting worse and you've been told there's nothing to do about it, I want you to know that's not always true. The 5 fruits coming up, especially numbers 3, 2, and 1, target biological processes that most eye care plans completely ignore. Oxidative damage is one thing, but inflammation, circulation failure, and glycation, those are the ones that sneak up quietly. And that's exactly where this list gets serious. Keep watching. Number 5, blackcurrant. Tiny, deep purple, easy to overlook. Most Americans walk right past blackcurrants at the grocery store. And that's exactly why so many people over 60 are struggling with night vision and halos around headlights and can't figure out why. Here's the specific problem blackcurrants address: retinal microinflammation and reduced blood flow to the optic nerve. That chronic low-grade inflammation doesn't feel like anything. There's no pain, no obvious symptom. But over years, it blurs your vision in dim light, creates halos around headlights, and causes progressive eye strain that a stronger glasses prescription simply cannot fix. What makes blackcurrants so effective is their anthocyanin content, and it's extraordinary. Inside your eye, anthocyanins do 3 things simultaneously. They calm inflammation, they support blood vessel dilation, and they help restore rhodopsin, the visual pigment responsible for dark adaptation. That's your eye's ability to shift from bright light to darkness without that temporary blinding effect. A randomized, placebo-controlled trial found that 50 milligrams of blackcurrant anthocyanins daily over 24 months significantly improved blood flow to the optic nerve and measurably slowed visual field loss compared to placebo. A separate study found blackcurrant anthocyanins increased retinal blood flow without affecting eye pressure. That's neuroprotective potential in a berry most people have never bought. Fresh blackcurrants are hard to find in most stores. Look for a standardized extract around 50 milligrams daily, taken in the evening. For better absorption, pair it with a small amount of healthy fat, a few walnuts, or a vitamin C source like a slice of orange. Think of it like a duet. Blackcurrant opens the door, vitamin C holds it open long enough for everything else to walk through. Blackcurrant protects your optic nerve. But what about the photoreceptors themselves, the cells that actually capture light and send it to your brain? That's where number 4 comes in. And I have to tell you, I was giving my patients the wrong advice about this one for years. Number 4, wild blueberries. For the first decade of my practice, I told patients to eat blueberries. Any blueberries. I was wrong. The large, shiny, cultivated blueberries in your produce section have measurably lower antioxidant density than wild blueberries. Wild blueberries, the small, dark ones in the frozen section, carry nearly double the concentration of active compounds. Double. Same fruit, completely different outcome. The key compound is pterostilbene. It's more bioavailable than resveratrol, meaning your body can actually use it. Here's the part that matters most. Most antioxidants are like mail that never gets past the front door, absorbed into general circulation but never reaching the specific tissue that needs them. Pterostilbene actually gets inside, past the blood-retinal barrier, directly into the cells that are doing the repair work. That's the difference between eating for general health and eating specifically for your eyes. Here's the moment I want you to really hear. A 2023 study published in Nutritional Neuroscience followed older adults who consumed wild blueberries daily for 12 weeks. The results showed notable improvements in visual acuity and significantly less eye strain when viewing screens in low light. 12 weeks. Frozen aisle. Under $5 a bag. Here's the critical mistake most people make. Don't combine blueberries with dairy. Milk proteins physically bind to anthocyanins in your gut and block absorption. You're eating the right food and canceling out the benefit. And here's a prep step almost nobody does. Lightly freeze your blueberries, then let them thaw before eating. That freeze-thaw process breaks down cell walls and dramatically increases bioavailability. About a third of a cup 45 minutes before bed. We're halfway through, and I need to share something that stopped me cold the first time I read it. A long-term study out of the University of Wisconsin followed adults over 65 for nearly a decade. They split participants by dietary carotenoid intake, basically, how many of these eye nutrients they were getting from food. The group with the lowest intake was 3.8 times more likely to develop advanced macular degeneration. Not slightly more likely. Nearly 4 times. And it wasn't genetics, it wasn't luck, it came down to what they were eating, or more specifically, what they weren't eating. 4 times the risk from diet alone. Let that land for a second, because the next 3 fruits on this list are exactly what those low-intake patients were missing. Number 3 looks like it belongs in a still life painting. Number 2 has 2,000 years of clinical history behind it. And number 1 targets the process most people have never even heard of. Still with me? Good. Number 3, red dragon fruit. I need to ask you something. Do you ever wake up with heavy, tired eyes even after a full 8 hours of sleep? Like your eyes worked all night instead of resting? That's not in your head. It's about oxygen delivery. Specifically, something called retinal hypoxia, when your retinal tissue isn't receiving adequate oxygen during sleep. When that happens, you can sleep a full 8 hours and still wake up with fatigued eyes, flattened color perception, and peripheral vision that's just slightly off. Over time, the cumulative damage is significant. Here's what red dragon fruit does about it. One thing, get the red-fleshed kind. The white variety doesn't have what we're after. The color is the compound. Red dragon fruit is rich in betalains, antioxidants that support nitric oxide production in blood vessel walls. Think of nitric oxide as a traffic controller for your capillaries. It clears the lane. It tells the tiny vessels supplying your retina to relax and widen, so oxygen and nutrients can actually get through during deep sleep. Wider lanes, better delivery, less retinal fatigue by morning. A 2022 study published in Frontiers in Aging Biology reported that participants who consumed red dragon fruit extract for 6 weeks showed meaningful improvements in ocular circulation, contrast sensitivity, and visual field depth. In practical terms, they could see more clearly in low light and reported noticeably less blurry vision. Half a red-fleshed dragon fruit, about 60 minutes before bed. And here's the one detail most people miss completely. Don't swallow the seeds whole. Chew them. Those tiny black seeds contain omega-3 fatty acids and magnesium, both of which play documented roles in retinal nerve health and overnight repair. Swallowed whole, you lose almost all of that benefit. Chew the seeds. Strange advice, real payoff. Quick check-in, are you taking notes? Drop a comment if you're already eating any of these fruits. I want to know what you're working with. Now, number 2, This one has been used for over 2,000 years specifically for eye health. The clinical evidence is only now starting to catch up. The look on Eleanor's face, I've seen it more times than I can count. 74 years old. Seattle. She didn't cry. She just sat very still and asked me one question. Is there anything I can actually do? She'd just been told she had early-stage macular degeneration. Come back in 6 months, monitor it, see if it progresses. I told her about goji berries. She was skeptical. I don't blame her. 6 weeks later, her follow-up showed measurable improvement in macular pigment optical density, which is a direct, quantifiable measure of macular protection. And for the first time in years, she woke up and could see her husband's face clearly without waiting for her eyes to load. Her words, not mine. Here's why goji berries work. Think of your macula like the center dot on a dartboard. Everything else on your retina catches the big picture shapes, movement, peripheral space. The macula catches the detail. Faces, words on a page, the expression in someone's eyes when they're talking to you. It's the bullseye, and it's the first thing that goes. As we age, oxidative stress and reduced circulation gradually degrade this tissue. That's the foundational process behind age-related macular degeneration, the leading cause of irreversible vision loss in adults over 60 worldwide. Goji berries are among the highest natural dietary sources of zeaxanthin on the planet. Zeaxanthin doesn't spread itself across the whole retina. It goes specifically to that center dot, the bullseye. That targeted delivery is what makes goji berries different from nearly everything else on this list. A 2021 study published in Nutrients followed adults aged 60 to 80 who consumed dried goji berries 5 days a week for 90 days. Results showed a significant increase in macular pigment optical density, and no participant in the goji group showed further progression of macular degeneration during the trial period. For anyone worried about losing central vision, that finding deserves serious attention. Soak 2 tablespoons of dried goji berries in warm water for 10 minutes, then eat them about 30 minutes before bed. And here's the synergy tip with actual science behind it. Pair your goji berries with a small square of dark chocolate, at least 85% cacao. The flavonoids in high-quality cocoa enhance the absorption of zeaxanthin. Together, they create a nutrient combination your macula can actually use. Eleanor calls it her dessert that works. Results may vary. Eleanor's case is one example. This is not medical advice, and if you have a diagnosed eye condition, please work directly with your ophthalmologist before making dietary changes. And now, number 1. The fruit that started this whole list for me because it targets the process I mentioned at the very beginning. The one your eye doctor has probably never mentioned. Glycation. Number 1, papaya. Let me explain glycation properly, because once you understand it, you'll never look at your morning vision the same way. When excess blood glucose circulates in your body, and this happens in almost everyone over 60, not just diabetics, it binds to proteins in your tissue. In your eye, it binds to the proteins in your lens. Over time, it forms compounds called advanced glycation end products. Think of it like rust forming on the inside of a pipe. Slow, invisible, painless, until one day the water doesn't flow the way it used to. That clouding of your lens, that loss of contrast sensitivity, the way colors look slightly washed out compared to 10 years ago, glycation is often a major contributor. And almost nobody's addressing it nutritionally. Papaya goes directly after it. Papaya contains papain, a naturally occurring enzyme with documented anti-inflammatory and protein-modifying properties. It also delivers a powerful combination of vitamins A, C, and E, alongside folate nutrients linked to tear film stability, retinal protection, and reduced oxidative stress inside the eye. A 2023 study published in Clinical Gerontology found that older adults who consumed papaya in the evening showed lower levels of glycation markers in follow-up testing, alongside stronger tear production and measurable improvements in contrast vision within just 6 weeks. 6 weeks. 1 cup of ripe papaya cubes, about 60 minutes before bed. And 2 things matter here, and most people get both of them wrong. First, fresh is significantly better than processed. Canned papaya. Papaya juice, the papain is largely destroyed in processing. You need fresh. Second, room temperature is better than cold. Cold suppresses enzyme activity. Take your papaya out of the refrigerator at least 30 minutes before eating. Let it come to room temperature so papain is fully active when it reaches your digestive system. And one more thing, squeeze fresh lime juice over your papaya before eating. The vitamin C in lime meaningfully boosts your body's absorption of vitamin A. And honestly, it tastes considerably better too. Don't pair it with dairy. Same absorption blocking issue as blueberries. Fresh papaya, room temperature, lime juice, 60 minutes before bed. That's it. That's number one. Before you run to the grocery store, hold on. Because I've watched patients eat every single one of these fruits and still not get the full benefit. It always came down to one of 5 mistakes. Rule 1. Keep dairy separate. Milk proteins block the absorption of anthocyanins and lutein by up to 30%. Give yourself at least 90 minutes between dairy and your evening fruit. Treat it as a standalone snack. And here's the uncomfortable part of this rule. That big glass of calcium-fortified orange juice most people drink with breakfast? It's actively blocking the nutrients your eyes spend all night trying to absorb. Calcium and carotenoids compete for the same absorption pathway. You sleep 8 hours building up the supply, then one glass in the morning cuts the delivery by 30%. That's not a small number. I'm not saying stop drinking it. I'm saying don't drink it within 90 minutes of your evening fruit. Timing is everything. Rule 2. Always add a small amount of healthy fat. Most nutrients in these fruits are fat-soluble. A few walnuts, a teaspoon of flaxseed oil, or a few slices of avocado can boost absorption by more than 50%. Same food, dramatically better delivery to your eyes. Rule 3. Wash gently. Aggressive scrubbing removes surface antioxidants, especially on blueberries and black currants, where the protective compounds are concentrated near the skin. Rinse under cool water, pat dry. Wash right before eating, not hours in advance. Rule 4. Room temperature, not cold. Cold suppresses enzyme activity across almost everything on this list. Let your fruit come to room temperature 30 to 60 minutes before eating. Cold food, less benefit. It's that simple. Rule 5. Hit the timing window, 60 to 90 minutes before bed. Too early and the nutrients are metabolized before your repair window opens. Too late, and active digestion disrupts the deep sleep your eyes need to actually do the work. Hit that 60 to 90 minute window and you give these compounds the best possible chance to work. Which of these 5 rules do you think you've been getting wrong? I'll tell you what I hear most often. It's the dairy one every time. People have kiwi with yogurt, blueberries with milk, and then wonder why nothing changes. Drop your guess in the comments. Let me bring this all together. Blurry vision after 60 is not inevitable. It's often the result of specific, addressable processes happening inside your eye tissue: oxidative damage, chronic inflammation, poor circulation, and glycation. Golden kiwi and wild blueberries for photoreceptor protection. Watermelon and red dragon fruit for circulation and oxygen delivery. Black currant for dark adaptation and optic nerve health. Goji berries for your macula. And papaya for the process most people never even knew was happening. None of this is magic. It's supply and demand. Your eyes are running a repair cycle every night. The question is whether you're giving them what they need to actually do it. Eleanor came back for a checkup 4 months after we talked about goji berries and papaya. She sat down in the exam chair and said, "Before I even looked at her chart, I can see my garden again. First thing in the morning. No waiting. No fog." That's not a small thing. That's the difference between starting your day and starting your day already exhausted. If you have diabetes, high blood pressure, or are currently managing a diagnosed eye condition, please bring this information to your doctor before making changes. Some of these fruits interact with blood sugar and blood pressure. Your specific situation matters. I'm not saying this to cover myself, I'm saying it because your eyes are too important to navigate alone. Here's what I want you to take from today. Your eyes are not just getting old, they're getting underfueled. And tonight you can start changing that with something you can buy at any grocery store. I want you to picture something for a second. Waking up tomorrow morning and seeing clearly, not in an hour, not after coffee, right away, reading the menu across the restaurant without leaning in, driving at night without that tight grip on the wheel, looking across the room at the people who matter most to you and actually seeing them, every detail, not wondering if your vision is good enough, just seeing clearly, without effort. That's not too much to ask for, and it starts with what you put on your nightstand tonight. Remember this, you don't lose your vision all at once. You lose it in the gaps between what your eyes need and what you give them. Fill the gap, starting tonight. If this opened your eyes, pun intended, share it with someone over 60 inches your life, not because I need the views, because you might genuinely make a difference for them. Tell me in the comments, which fruit are you starting with tonight? I'm Dr. Malik Jackson. Take care of your eyes, they're already working harder than you know.